Good morning, everyone, and afternoon to those who are in Central or Eastern time zones. I am Jack Myers. I'm the Director of Sales and Marketing for North America here at Convergence Networks. I want to thank you for attending today's webinar, Unpacking the Change Healthcare Breach. I'm sitting in our U.S. headquarters today in the beautiful city of Portland, Oregon. And myself and our panelists are excited about this topic. It's one of, if not potentially the biggest cybersecurity breach in modern history and has affected so many different facets of the healthcare industry. It's almost too many to count. And you might be wondering why we're doing this. And it's part of our focus on educational topics this year. This one in particular stood out to us in a really big way. It had an effect on us professionally and personally. And for Convergence, we are pretty involved in the healthcare industry. It's a big piece of our business across every region that we serve, whether it be community health centers or specialty clinics and care providers, as well as our Canadian healthcare organizations. And we all need healthcare and we all need care at some point in time in our lives. So this is really also pretty personal for a lot of us. Cybersecurity risks and concerns are obviously one of the top three initiatives for every client that we work with, but also with prospective clients that we speak with today. Security incidents like this really kind of shake up our senses. It reminds us to be vigilant, be more aware of not trying to click on the wrong things. Leadership proactively budgeting and planning to figure out what comes next to keep business moving. And obviously, we all want to protect the unique information patients and our customers share to receive our services or purchase our products. And so today I'd like to introduce our speakers. If you don't mind, I want to move on. We'll start with Colin. If each of you wouldn't mind, share a little with the audience about yourself and your organization.
Yeah, thanks, Jack. My name is Colin Robinson. I'm the Chief Technology Officer for One Community Health. Been working within an IT space for a little over 10 years, in leadership for about that same amount of time within there. Been with One Community Health for the last 5.5 years. I don't know where all that time has gone. One Community Health is a federally qualified healthcare center that's located in the Columbia River Gorge, right there between Oregon and Washington on the border. We have 4 brick and mortar sites along with some additional mobile outreach on that, and we provide a lot of primary care services, dental, and integrated behavioral health within that space.
Awesome. Thanks, Colin. And Zebediah.
Sure. Hi, I'm Zebediah Wade. I work in the insurance industry for the Port Insurance. We're a Pacific Northwest agency, serve clients all over the United States. I specialize in the cyber insurance area. I have a number of medical clients that were impacted by this. And so I look forward to sharing some of their stories and how we're trying to help them.
Yeah, thanks for bringing in some of those stories to share with us. And John.
Sure. Glad to be here. Welcome, everyone. My name's John Stevens. As Jack mentioned, I'm the CISO for Convergence Networks. Been in IT and specifically IT security for more years than I care to count. And I've played a number of different roles within that space. So been there, done that, and hopefully we'll be able to move forward and keep things secure.
Thanks, John. Yes. I'm actually going to start with you, John, to kick things off. This is a pretty significant breach. It's impacted a lot of organizations. So I'd like to kind of start, if you wouldn't mind giving us sort of a recap on the scope of the breach and the impact across the healthcare industry.
Sure. So before we start talking directly about the scope of the breach, it probably behooves us to speak a little bit about Change Health, specifically their size and scope and the fact that they touch so much of the processing that goes through the medical healthcare system here in the US. So, Change Healthcare combined with Optum Insight back in January of 2021, Quantum Insight was a technology platform from, excuse me, that's Optum Insight, technology platform from Optum. And basically, they put together this juggernaut of a medical storage and processing provider. And in fact, I believe the statistics indicate that Change touches like 1 out of every 3 claims processed in the US or something. So we're talking about an organization and a platform that has its hands in virtually all of the healthcare transactions. And then when we start talking about that organization getting breached, we're talking about things reported, for example, like nearly 94% of hospitals were reporting some kind of financial impact due to this breach. More than half of them described the impact as significant or serious, and over 33% reported an impact on more than half of their revenue, with approximately 60% estimating daily revenue losses exceeded 1 million. So we have this huge healthcare processing and insurance transaction organization and platform, and then they're breached. And so, of course, with as big as they are, that means that we saw that many folks affected by this breach. And in fact, one of the United Health representatives is quoted to have said that the impact could cover a substantial proportion of people in America, with folks putting that to as high as 1 out of every 3. So this is a really big breach, and the impacts are far reaching and very deep.
Yeah, I read an article that said that as of April, Change had reported upwards of $1 billion starting as far back as April that they had been calculating and capturing and trying to understand. And I don't think it's nearly done. And obviously, timeline of these events, moving on to kind of understanding that timeline, how did that impact the severity of the breach in the end?
Well, so ultimately, unfortunately, in today's environment, we normally read about attacks that the malicious actors were in the system for weeks, months, in some cases, years. Now, in this case, that's not true. We're only looking at about a 9-day period from what was identified as the initial ingress to when they actually triggered the ransomware attack. So this one is a little bit different from a lot of what we typically see. However, the reason it was the attack was initiated so quickly is probably because the attackers realized just exactly all that they had. Because after those 9 days, the ransomware was initiated, and that was the effort was claimed by Alpha V or Black Cat, 2 different names for the same organization. And that was, again, middle of February, approaching the end of February when the ransomware demand came out. And around the 3rd is when Change allegedly paid the ransom. That has subsequently been confirmed in congressional testimony that they did pay the ransom. That was despite the fact that they were trying to restore their systems previously, presumably on this timeline. That March 22nd likely represents when they received the key from the perpetrators. Like I mentioned, there was congressional testimony in May, and currently we're still unsure of when this is going to end, which is something that we can speak to a little bit on the next slide.
Yeah, well, I mean, you brought it up initially, 9 days. They realized the pot of the gold was at the end of the rainbow, as we hear oftentimes, right? Can you talk a little bit more about what the pot of gold included and the type of information of why they likely acted so quickly and what was recently announced as far as the kinds of data that was available and what they gained access to?
Sure. And so there's been a lot of supposition about what kind of data, how in depth was the data set. There's been some discussion, oh, well, was it taken out of an EMR, an electronic medical record, or an electronic health record, EHR? Ultimately, there was a lot of supposition without a lot of facts. But in the last couple weeks, Change has started releasing some of that information. And this list that you see on the slide before you is actually that list provided by Change. And so they're talking about, of course, health insurance information, whether that be primary, secondary, or other health policies, member group IDs, government payer ID numbers. And because it's billing, it also included things like health information, such as, providers, diagnoses, medicines, test results, images, care, and everything else. And then again, because it's billing, we have the information on the financial end of it, claims numbers, account numbers, et cetera. And then finally, because this is, health records are such a in-depth and comprehensive tally of so much personal information. We also had that PII that references in that last bullet to include social security's number, driver's license numbers, or state IDs, or even passport numbers. It was a veritable cornucopia of all of the data that the malicious actors love to get at.
Yeah, that makes sense. And I know that there is some intimation around when disclosure and notices and things like that. There was a recent update with that as well. And throughout this panel, we're going to have a couple of polls that'll pop up. We'd love for you all to engage with those, answer some of those questions, and help us understand a little bit about the audience, your organization's impact as well. If there are any Q&A questions that you have or things that you would like us to talk about towards the end of this panel, please post them and we'll review that at the end and have one of our experts provide some feedback to you throughout the process. But John, I want to jump in next to explaining what happened. When is this gonna potentially hit the notification and disclosure window and that sort of information?
Sure. And you might have seen it pop up just briefly on the last slide, but Change is indicating that they expect their notifications to start towards the tail end of July. And so if you think about this as an event that occurred in February, and it's taken us quite a while just to get to where notifications are assumed to be going out, that still leaves a whole lot of room where people have been left kind of out in the cold wondering what's going on. So Change is estimating that those notifications will go out round about the end of July. And it's important to note that the Office of Civil Rights through the Department of Health and Human Services with the federal government has provided the go-ahead for Change to provide those notifications rather than where it would normally fall with the individual clinics and providers. Other updates that came out, at the end of the slide on the timeline, we were saying, hey, we're in a bit of an ambiguous place because there was some confusion because the Black Cat ransom gang apparently took all of the ransom and then disbanded, or at least said they would, and they left their affiliate who was utilizing their platform. Again, they're all criminals who was utilizing the platform. They said, well, they didn't get their cut of the pie. And so they were making ransom demands as well. And so for a brief while, there was some of Change Healthcare's information present on a site called Ransom Hub. And then suddenly that just went away. And there's supposition that, in fact, Change may have paid another ransom above and beyond the $22 million estimated, which was the first ransom. And of course, ultimately, the sad part about this all is, organizations like Change, they may be weighing how do they recover? How do they get things online? How do they stop the bleeding? It's kind of a triage situation. Yeah. But ultimately, if you're paying criminals, what are the chances that they're really going to delete their data when they say they are? Or is this something that's going to come up later? And then a final footnote, doing some research this week, it looks like as of June 7th, there are 49 lawsuits that have been filed against Change Healthcare in federal court relating to this issue. And granted, like we said, we're nearly almost 6 months out, give or take, and only 49 lawsuits given the scope of that, I'm sure that number will continue to rise.
Yeah, it doesn't surprise me. It does illuminate the fact, though, that there are still a number of unknowns, right? And so I want to talk a little bit about that because it's great that change is on the hook for notification. That alleviates a lot of pressure on the clinics and the providers at the local level and the hospital systems, right? Lots and lots of data around how the hospitals were affected, but I want to kind of bring this to a little bit of a different spin. And Colin, I want to start with you because while your organization is not necessarily a hospital, you are a community health center. And so, what were some of the initial indicators of compromise that alerted your organization to the breach?
Yeah, thanks, Jack. So initially, um, we, with just the scope of the impact of this, I think the biggest thing that was the tip off for us initially that something was very wrong out of the ordinary came very early in the process. I think we went over John's timeline there. The morning of February 22nd was when we started seeing kind of
Mm,
mass failures on our claims processing
mm,
to from some of our insurers. We mentioned not it wasn't a vast majority of our payers that were on the system, luckily for us, but it was a significant number that we could see that be failing in mass first thing in that morning. It also would have led to any attempts to provide insurance verification for any of those payers on the front end was also failing. Um, but when we see a mass failure like that on the charge side, it raised some red flags from that. Our EHR vendor posted up their alert to that front, giving us a few options of what to do. And I know none of those are happy and promising ones, and some change in workflow that we can also get into at some point. But some of the other ways we were hearing initial verification or essentially initial notification was from some of our partner ends, especially around pharmacy. Um,
oh,
where we were hearing from our um, pharmacists in the area that they also couldn't be verifying insurance. They didn't know if the medication ended up having its pre-op, if it was following all these restrictions.
wow.
Luckily for our community, those pharmacists decided we're just going to trust you and go, and that's not a decision they had to make. But we're still unsure how all that's going to come back around in the end because I'm not
Yeah.
sure how many patients might be stuck with a bill for an unauthorized, non-covered prescription at that point. I think there's still a lot of unknowns that we've been talking about, but saw that from the partner end, and we're seeing that through a lot of our claim failure as well.
Wow. And you all work with thousands of people in the community on a regular basis annually. I can't imagine how it would feel to, not have your life-saving heart medication or something for your kid that they need at that point in time. That's got to be incredibly challenging. Um, Zeb, there's something on here that I think this whole component around the insurance side of it, right, and cyber liability insurance. And I know a lot of our audience probably isn't familiar with what a self-insured organization means. Can you talk about if there are any differences between a typical cyber liability insurance policy and an organization like Change that did self-insurance?
Sure. Yeah. Well, insurance is really kind of the idea of transferring the risk. So I'm going to move my risk to somebody else. And in a self-insured world, you're essentially saying I'm going to foot the bill. So if there's an incident, something happens, it's on me to figure it out.
Mm-hmm.
Admittedly, the size of this company, finding a third party that's going to say, yeah, I'll insure you for $22 million or, or any kind of large number like that, it's going to be pretty hard to find somebody that wants to do that. But it's scenario in which, hey, if you don't have the cash flow or you don't have the capital in order to put forward the dollars required for an incident, it can be pretty dramatic.
And are there differences between what maybe a typical cyber liability insurance carrier would underwrite versus self-insuring and what you would underwrite? Knowing that this might have been something they couldn't have gotten backed by a typical carrier or a mass carrier.
To an extent, typically you're going to see I mean, what I'm interested to see is what is going to be the cost for the notification.
Mm,
That is something that typically is covered under an insurance policy, and that can be pretty dramatic. So you're talking about I got to send mailers to everybody. I've also got to more than likely provide some sort of monitoring solution. And then I got the fines and penalties that are included. I mean, some of these people had to go in front of Congress. The lawyer bills for that process, I don't even want to think about what that cost.
yeah. Yeah, right. You think about potentially one in every three US citizens impacted by this, that's 100 million plus people. Not all of them obviously are credit of age of credit, but that's a significant impact. And it's still somewhat of an unknown of whether or not this is going to have a catastrophic financial impact to change
Mhm.
healthcare. Um, the other part of it, I think, for the personal side of it, that's really kind of important in my perspective. Last year everybody had the Move It breach, right, and all of our driver's license information and our court filings, all these, the impact of the Move It breach. John, I want to switch over to you for a little bit. So we don't know whether the data was deleted without confirmation of that from the original hackers, and now an affiliate stepping in to what apparently looks like they extorted and got paid. Where does this go from here?
So I think this really illustrates the state of our cyber landscape today. Ultimately,
Okay.
you've got an attack that is, first they're extorting an organization to unencrypt their data. Then there's also oftentimes extorting them to promise to delete the data. But ultimately, this was a case in point where we saw, well, there were two different criminal groups and they started arguing amongst themselves. So it complicated it further. And then there's the fact that even if you pay the ransom, is it reasonable to expect that the data is really deleted? Because in fact, we're talking about criminals who extorted you.
Yeah.
Where's the verification? But if we think about the history of ransomware, when it first started coming out, we were dealing with ransoms of maybe hundreds of dollars. Now we're looking at 22 million, and ransom may have been paid twice. So I think this just absolutely illustrates the risk environment that we have to deal with here, where there are so many risks and hazards that ultimately I understand why organizations pay the ransom, but at a certain point, we have to get to a point where that's not an option, frankly,
Yeah.
because it perpetuates the continuation of the ransomware gangs.
Yeah. And whether they disbanded or not, who knows? Whether the second organization deleted the data, who knows? I've never been in a situation where I think I could ever really trust a criminal to do what they say they're going to do. And you find out later on in other breaches that a lot of organizations that pay the ransom end up the data still gets up somewhere on the dark web for sale. Um, I want to move on to beyond the breach and kind of thinking about this at more of a local level, right? At the healthcare practice level. And I want to start first with sort of unpacking a little bit of one of the personal scenarios, Zeb, that you had shared about one of your clients. And at a high level, can you provide us with just a brief overview of one of your clients' financial scenarios that unfolded once the incident kind of took hold of their practice?
Sure. And I know we're going to get into the weeds or a little bit more in the weeds on the financial side. But this was a vendor breach. So instead of it being a scenario in which the clinic had a breach on their system. This is
Mhm.
completely separate of that. And so when the vendor and a lot of the smaller clinics that I partner with, talking 11 or so, maybe 30 physicians, nothing gigantic. They had one uh, essentially broker dealer or place of which clearinghouse to have all this playthrough. And so when this system went down, we're talking massive impacts to the cash flow.
Yeah.
So it dramatically affected the smaller shops that use change in a disproportionate way of anybody else. And in terms of, okay, well, should we have had a secondary payer? Should we have had or a process? Should we have had redundancy in that world? Well, that depends. Does your EHR allow you to?
Yeah.
Are there other ways to do it? And this was, in my opinion, sort of an example of the nature of this size of a company and the monopoly that it has. Um, it was dramatically impactful.
Yeah. I can't imagine. And, Colin, I know you said there wasn't necessarily considered a massive impact to your organization, but can you speak to how it impacted patient trust and how that will kind of play into the aftermath for One Community Health?
Yeah, I think most of that question is still going to be to be determined as we are looking at how notification comes across, how they end up performing it. Um, Most of the rules surrounding notification on this are not built for the scope of a breach like this.
Yeah, I bet.
We um, I think the threshold is alternate. I think it's $250,000 for the cost of notification, or 350,000 people to be notified, and
Yeah.
would be the thresholds of which they're required to hold up to. And I think based off what we know on this so far, um, we should be well beyond all of those numbers. So it's really going to be up to change on what they decide to do and how they decide to communicate. But when those
Yeah.
letters go out and those letters hit the community, um, how they're going to respond, who they're going to look to support this, and who's going to receive that. Anytime we have a breach in trust in this, when it comes to health information getting leaked, um, it can shake your confidence in that vendor and partner, and within healthcare and within that space, the trust between your doctor and you is something that you takes a long time to build, but does not take long to break.
Yeah, that's really unfortunate. And obviously, the threats to the healthcare industry are not over. John, there was a recent article that was published just a few weeks ago um, around this particular incident. And it called out 14 additional vulnerabilities to be aware of in the aftermath of the incident. Um, what new practices in prevention should healthcare providers be considering as part of their cyber risk management strategy?
Sure. So it's important to point out that, we've had HIPAA in the US for decades. And
Mhm.
it's something that I believe most healthcare practitioners and their staff are familiar with in regard to the clinical operations. But one of the things that HIPAA does, or actually more accurately does not, is it doesn't list a bunch of technical solutions that you need to implement. It talks about implementing reasonable and appropriate controls. And the reason this is relevant is when you think about what's reasonable and appropriate in today's environment compared to the early 90s, it's night and day. And
Mm.
furthermore, that means that there's going to be a lot of technical things that organizations should be doing to meet the standard of what's reasonable and appropriate for their size and complexity of operation.
Mhm.
And to speak specifically to some of those things that the OCR recommended, like really doing a no holds barred business risk analysis. I think oftentimes when you think about this from a healthcare provider, you're really looking at how do we protect the EMR or the EHR? How do we ensure that we are respecting privacy? We're not shouting out diagnoses where other patients can hear and what have you. But in fact, I think the biggest thing that this illustrates is one, that you have all of this confluence of events coming together in such a big manner, but also, every organization needs to look beyond the compliance and look to the specifics. So whether you're talking about what do you do in the in the event of ransomware, can you continue to do business if your data is not available? In this case, to my knowledge, no EMR or EHR was directly affected, but yet we have this snowball that affects 1 in 3 folks in the U.S. How many clinics actually look at the vendor risk associated with their stack? And to Zeb's earlier point, how many of them actually get to choose?
Yeah.
We normally think about business continuity and disaster recovery as kind of an IT affair, but this actually is something that if you're just following HIPAA compliance, it may not have prepared you for, because you might have a backup of all your data. You may have all of your security controls in place, but if all of a sudden you can't get billables and revenue, how does that impact the business? And I think the primary thing that we're seeing here is you have to look at it from a whole of business perspective now, not just protecting the mandatorily protected data that the federal government says you have to address. And of course, just to complete the list, we've got all of these new attack vectors, whether it's AI or large language models, Internet of Things. These are all things that are part of today's landscape. So if you really want to get down to doing what's reasonable and appropriate, you have to consider all of those along with the business risk.
Yeah, thanks, John. We're talking about the business, we're talking about the providers themselves. Patients in the end is a big component of this. So I kind of want to move on to that and understand a little bit more. Zeb, you've got some real world experiences. You had clients go through. What was the immediate patient experience and changes your clients' practice went through when this happened?
Yeah. Well, there's quite a few different areas in which the impact was felt. A quote from one of my clients was, many clients had issues with care. An example would be a client would have an appointment on a Wednesday, but because of this breach, they couldn't get the lab results.
Yeah.
So we're looking at, hey, we're supposed to be reviewing what we had you go get tested, but we can't because we don't have any. You had scenarios in which clinics had to essentially pause, and they had to say, hey, we got to wait a second to see, because we don't know, one, if we can verify that you have insurance and copay and figure out the financials of it. And then the flip side is, can we get paid? And then how am I going to float this? We did have physicians leave because there was, I would call it too much stress involved. And hey, I don't know that I can continue to operate if I'm not getting paid.
Yeah.
And again, in the small rural or more localized clinics, it was pretty impactful across the board.
Yeah, I bet cash is king, and if you don't have it, obviously, it makes it really hard to, uh, you know, convey confidence, trust within your own employee group. But your patients, obviously, if they're not able to get that care and get their results and continue to progress forward in treatment, it erodes pretty quickly, I can imagine. Colin, you had said obviously that the organizational level impact was there. And that translates over into patient care experience. How did your organization have to adapt internally? And have you been able to return to your normal rhythm and service and operations yet?
Yeah, I think I had referenced when on the 22nd, when we got our post,
Yeah.
that our claims were interrupted from there. We kind of had to pivot and make some decisions based off that. We had, 3 options from here: print those claims, shove them in envelopes, throw throw a stamp on them and hope they make it in a reasonable time, um, hold the claims for whatever
Oh,
unknown amount of time from there, or pivot and go see what kind of payer portals those folks might have and start some manual data entry.
mm,
And you kind of had that pivot from the front desk end. As a FQHC, we're going to federally qualified healthcare center, we're going to see folks regardless of their ability to pay for that.
yeah,
So there's no question as to whether we'd see folks or not, but
good.
whether we're going to get payment on that end and how we might follow up on it just became a big question and a concern surrounding parts of that. So we mostly had our finance and billing teams swinging into action, decided to start stuffing some envelopes. And
Wow.
in the end, and we are essentially back to normal from this, but working with our vendor, there are still some payers that they're working to bypass
Mm,
change as an option there to take.
okay.
And still a weekly update from our vendor on their work uh, in being able to create a second option and a workaround for some of these change connections. So
Wow.
it's still very much not over and finished on that front.
Yeah.
But for a lot of the operational changes for us, we've kind of been able to revert back to normal, but kind of keeping an eye on those notifications and seeing how that continues to progress.
Yeah. When you're EHR and you are beholden to the back end platform that they're using, it makes it very difficult. And obviously, staff having to do things like putting together envelopes and stamps and all. It's just a huge shift and a massive amount of additional work. I'm sure that patients appreciate everything that you all have done to move forward, but obviously, your organization on the patient care side is pretty significant in the sense that you were able to step in and you all did your services anyways, and that's a testament to your organization and sort of what you do in the community. I want to move on to the direct impact, really more around finances and accounting, accounts receivable side of it. So, Zeb, you'd already mentioned that you had a client with a pretty massive financial impact when this hit. Can you speak to the practice owner's experience on a more personal level and what they went through?
Sure. Another quote that I obtained was that this was an unmitigated disaster on my clinic's cash flow.
Ooh,
Um, and that, that's a very powerful statement. I had an owner or practice manager that decided to forego their own income to make sure that their staff were paid.
mm,
We had individuals that had to utilize their line of credit, and that interest against that line of credit is not something that they're going to get back.
eesh.
Um, Personally, loaning the business money to cover payroll and operating costs. A number of people had to do that. Um, and I mean, we still have, it's gotten better. But up until I think about 2 to 4 weeks ago, um, I had clients that still had hundreds of thousands of dollars in unpaid claims, and they're sitting
Oh,
there
wow.
waiting. We would hear the statements of, "Oh, it's coming. We're going to make it up," and that's finally occurred. But that's essentially 3.5, 4 months of floating cash that no one had a plan for.
Yeah, that's a lot of hands in the pot. Obviously, a big testament to the clinic owners and the partners and the physicians in that group to take those steps. But wow, that's a huge personal impact. And Colin, in your case, obviously you had mentioned that the impact wasn't necessarily as significant as Zeb's clients, but operationally, there must have been some issues the business had to absorb more indirectly, right?
Yeah, absolutely. I think we were really able to we're required to do some shifts. And I think we mentioned some of the workflow changes some of that adaptation at the front desk,
Yeah.
being able to answer questions from patients surrounding this, and being able to kind of shift and educate some folks around that. I think I was referencing a little bit of the pharmacy work, and I didn't go into detail that was us reaching out and building good relationships with those pharmacies and having to really activate on that end and
Yeah.
have a good lines of communication to be sure of that our patients were able to get those scripts filled and that we weren't having any of those interruptions. Um, we also had to ask those same questions that Zeb was mentioning, where it's, do we need to seek out additional relief funding for this? I know
Yeah.
CMS stood up a couple of programs for that, and we had to do some analysis on that. Stop and make a turn and go, is this going to impact cash flow enough on us right now where we have to do that? Healthcare is under extreme pressure right now with the unwinding of the national emergency, especially for us being a major Medicaid provider.
Oh, yeah.
About this is just also coinciding with the largest amount of patients dropping off of Medicaid in the state of Oregon within the same period of time. So
Ooh,
you're talking about a cascade of effects where you have a lot of financial pressure on the healthcare system right now. And then you tack this additional piece on for delays. And so it caused a lot of additional work outside of just the workflow changes, where we had to do a ton more forecasting and just make some decisions that um, we didn't have a lot of information to make. We
yeah.
still don't know when this is fully finished. I think John laid out the timeline really well, but we're still learning the scope of the change, and it won't be done for a while. Um, and it's very difficult to make some of those financial decisions when you're already under a considerable amount of just strain financially within most of the sector.
Yeah, I can't imagine. I kind of want to stick with you for this next one, Colin, as well, because you talked about your employees and all the different things that they had to do and what they were going through to sort of keep things moving forward. But I want to ask more specifically around the internal conversations. I can't imagine what staff went through, right? And some, as you're pointing out, still experiencing. What sorts of questions and impact did this have with the employees and kind of behind the scenes conversations that came up or questions they were asking?
Sure. I mean, in addition to that, United Healthcare is our insurance for our organization. So there's
Oh,
another stream of questions that would be attached to that. So you also have a personal aspect to this to employees and teams. Um, there are some questions about um, when we're what do we know, what information has been
yeah,
leaked, um, because there's a personal aspect and angle to that for all of our folks and staff. um, I I think our staff uh, is experienced enough, having gone through our own brushes with ransomware and bad actors within those environments, that they're asking very critical questions of this. How much is this going to impact operations? How much time um, will some of these systems be down? And we don't have
yeah,
a lot of good answers for that. And we just had to keep kind of our communication channels open as best we can, be transparent about what we know, what we don't, and just lean on the fact that we're still operating. We're going to still keep seeing our patients. It's not a spot we want to put anybody in,
yeah.
but as long as we could remain transparent and lean on some of those systems and processes, I think we were able to work through most of it.
Communication obviously was super key for your organization. The last thing we want somebody to worry about is, are we going to stay open? What are we going to do? And that's a huge, it's a huge emotional feeling, right, for the individual who's there to also help other individuals going through an emotional scenario. Zeb, what kind of happened with your clients? What were some of the questions that their staff were asking?
Yeah. Well, one scenario that was quite interesting is we had a client that outsourced all of this process. So they had a third party handling all the billing, everything else.
Hmm.
And this org that they had outsourced to was a pretty small shop of two people. And they had no game plan of how to
Mm.
handle this. And so internally, we had a situation in which an office manager quite literally drove over to the lab to help enter in manual information to bring back to the clinic.
Wow.
We had a scenario in which, individuals that do not have necessarily the experience trying to figure out how do we collect funds? What do we need to do? And reading everything that would come out and then operating under that. I think it's a great testament to the incredible character of those in the healthcare industry because the willingness of the employees to pivot, even though they're probably asking the question of, am I going to get paid? And
Yeah.
do I have income? Um, they said it's fine. We're going to go figure this out, and we're going to operate and do what we need to do to make sure that one, people are being taken care of, but two, that we can continue to operate the clinic and try to provide relief to whether it's the owners or managing partners.
Yeah. It's always tough when you have your own family to worry about too. You know, it makes it really difficult. Um, well, you hit on something that I think is really important. I kind of want to move into a question that I think is key here is that they didn't know what to do. Their vendor that they worked with wasn't really clear. John mentioned this a little bit earlier, John, and now we're talking about sort of that risk assessment. Can you give some context around what it means to actually incorporate a business risk analysis into your HIPAA compliance program at just a real quick high level?
Sure. So, um, all those folks that are familiar with HIPAA should understand and know that it requires periodic risk assessment. But what does that mean? And that's something that we're typically getting information when we look at guidance issued by the OCR and or enforcement reports. But ultimately, and this was a question that came in on our Q&A, how do you assess that vulnerability to these types of attacks? And fundamentally, you have to start by, understanding how your systems work. Make sure you understand all the dependencies. Make sure you understand the vendors, who has your data, where is it, etc. And then you have to start thinking about, well, what are the what ifs? What could happen? And fundamentally, that becomes the genesis or the foundation of a risk assessment. If you understand what you're doing, and then you can look at, well, what are all the what ifs that could affect that? And then
Yeah.
when you're looking at it that way, that can include things like, financial risks, revenue flows, et cetera. But it can also still look at some of those technical risks like, hey, do we have an appropriately configured firewall, et cetera, et cetera. But you
Yeah.
spend some time basically envisioning those questions and then answering them. And then the ones that the answers aren't satisfactory, you have to develop a risk mitigation plan so that you know what to do to remediate that risk. And frankly, this isn't something that's limited to HIPAA and healthcare. This is something that organizations across all industries really should be doing, especially in today's cyber environment. But importantly, it is we've used the term before, but it is a whole of business proposition. It doesn't do any good to pass a risk assessment to IT when they're thinking about, okay, so what do we have to do with the IT systems? But then if you pass that same assessment to the clinical staff, they approach it differently. They're going to prioritize what they need to get their daily stuff done.
Yeah.
And if we look at this particular example, well, this was ostensibly a situation that was rooted and most impactful on finance and frankly operations too, because you can't do operations if you don't know who's paying for it and so forth. But really the bottom line is that collaboration. You have to look at it holistically. You can't
Yeah.
just I ask IT to do it. You can't just ask the clinical staff. You can't just ask finance. It really requires all of them being consulted. And frankly, at the end of the day, after they've been consulted, it helps to look at it from a big picture. Well, what if, accounting's impacted? What does that do? And this breach was a perfect example of it. But
Yeah.
ultimately, it comes down to being proactive with your risk management. HIPAA does require periodic risk assessments, so it's in there. It's required, and recent guidance within the industry and from the OCR is that it's not just good enough to get a technical assessment. It's not just good enough to get a clinical assessment. You have to look at it from a whole of business perspective, and you have to make sure that you are getting all of the collaboration so that you can truly understand the total risk to the business.
Yeah, you make a good point there. And I think we see this in other cybersecurity frameworks as well, where vendor supply chain management is a component of the controls, which I think, as you're speaking to, was a little weak on the HIPAA side and is now being bolstered a little bit more. But you bring up something I think is really important is that the lens the different departments look at this through is going to be very different. And it really comes down to what I think is a good segue into the next component of the panel discussion is really around culture and the culture of being in cyber and being a cybersecurity focused organization. And so, Colin, I kind of want to go back to you because you've lived this path, and John, I'll get to you at the end of this, but as a technology leader for One Community Health, right? How important is the security mindset of all the employees in your organization?
Yeah, how important? I think that's some good framing of it. Just, I think it can often be viewed as a technology problem in general when we're talking about cybersecurity. And I think most folks
Yeah,
who would attend a call like this would know that is the exact opposite of it. It's like saying that um, every it would be then, I mean, in this context, I want to think about it as in anyone who's using this technology needs to be a steward of it. And
yeah,
all of our roles, all of our um, tasks we're performing on a day-to-day basis are using this technology. So to say that it's an IT problem just doesn't quite add up, and it doesn't quite make sense. And
yeah,
I think that um, being able to speak to the risk and to how that affects different teams, how that affects patient care, how that affects the employees, and be
hmm
able to communicate that risk and understand that at multiple different levels of the organization is how you get buy-in for these processes, how you can do more training, how you can grow more understanding and develop these cultures of safety surrounding cyber as much as you can around other needs for a culture of safety within your work environments. Um, I think that the difficulty is always going to be balancing ease of use and security from there. And
yeah,
I think being able to have the why, spend the time doing the risk analysis, involving all those levels of the organization. Um, I'd say the fastest way to get that buy-in from staff is to have them experience one of these incidents themselves,
unfortunately,
unfortunately. And this
yeah,
is the number one um, reason why conversations like this are important, because no one wants to have your staff, your patients, your operations go through experiences like this. Um, and you would be surprised by the resilience of all your staff, be surprised by the resilience of your teams. The experience that we went through here at One Community Health, um, I was so impressed by the capabilities and the ability to change and be just resilient down to your core operations there to continue to provide patient care. But it's something I never ever want to ask anyone to do,
yeah,
and
I
no one
bet.
ever wants to do it again. And so
Yeah,
that's when we're talking about risk assessments, being able to spend those times, having those teams think through what it's like when you don't have access to that system, when you lose access to all of these different types of systems, how you might respond, and get teams thinking that way, get their leadership thinking that way. It makes buy-in for these processes and helps you shift that security, shift that balance a little more towards security, even at the expense of a few of the ease of use processes.
Thanks. Yeah. Zeb, from your perspective on the insurance side, what does the culture of cybersecurity mean, and how does that, risk and insurance protections for the business, how are those impacted?
Great question. So the insurance world for cyber has continued to evolve dramatically over the last 6 years. We've had a number of carriers walk in, walk out because I make this statement probably too often. I don't know that insurance people really understand cyber security, and I would, and it goes the other way around, right?
Yeah.
And so having a culture in which MFA, call check-ins on, before you wire funds,
Yeah.
building the idea that it starts with the individual looking at the screen, and any individual looking at a screen is key.
Yeah.
And having a response plan. What happens if? Where do I go? What do I do? Who's my first call?
Yeah.
Those pieces, a statement that one of the convergence individuals that I partnered with has said, and I apologize if he's listening and I butcher this, but an ounce of prevention and planning is worth a pound of response. And
Yeah.
that is, in my opinion, the key to this whole thing. If you spend the time to plan and prevent, you will not regret it in the scenario when something happens.
Yeah, thanks for that. Well, as we wrap up and get ready to roll into the Q&A portion of today's event, we want to stress the importance of the recommended security controls to help you, your business, and peers who may not be here today. These are excellent means to maintain business operations, resiliency, and mitigate your cyber risks. If you're not doing all of these, you should start to think about that. And one thing to keep in mind is that you can invest tons of money into cybersecurity technology solutions, but we as humans are still probably the weakest link, and more education and training is paramount. As the risks continue to evolve, right, and systems become more exploitable after bad actors have time to figure out where their loopholes are, right? And so I want to say thank you, extend a huge gratitude to Colin, Zeb, and John Stevens, an immense amount of appreciation for our panelists today, sharing these experiences both on a personal level and then your knowledge with us. And so let's go ahead and start to unpack some of the questions captured from the audience today. And the first one that I am seeing here is what insurance coverage is typically available for cyber incidents? Zeb, maybe you can field this one.
Sure. There's probably a list of, I would say, 20 different perils or places in which coverage would come into play. It's liability. So it's the cost to respond to the incident, notification included. So how did they get in? What happened? How do I recover and keep going forward? Recover data, and then the fines and penalties. Those tend to be around an average of $230 per record stolen. So that number can skyrocket, obviously, very quickly. And then there's, fund transfer fraud. If you send money to the wrong place, that you're probably not going to get it back. But there is insurance that can help you if you follow a certain protocol.
Okay.
But the list goes on and on.
Okay. Recommend that you meet with your insurance broker to go over this if you have additional questions around whether or not you've got the right coverage within your policy. Another one here, this one looks like it's more probably for you, Colin. It says, How can healthcare practices assess their own vulnerability to similar breaches?
Feel like John had answered part of this question in some of
Okay.
his talk as well, but I think when we're looking at assessing vulnerability to similar breaches, it's mostly in at least our mentality and an aim for this is having a good vulnerability scanning process,
Okay.
external, internal schedules for pen testing, being able to review, have those function often, ensure that all these new vulnerabilities that are detected can be identified and addressed and remediated as soon as they're made aware of, especially for anything in high or critical when it's coming into that. So
Yeah.
having a good vulnerability scanning program is definitely the first place to start from there. I would check out some of the CISA and FBI resources on this, especially for
Oh, yeah.
and healthcare critical infrastructure for that. They have multiple free services that surround doing some of those vulnerability scanning as well, if you qualify as critical infrastructure. So that would be a good place to start. But that's
Okay.
an external scan. There's multiple different avenues to go down for some of the for a more robust scanning program.
Yeah. And then, of course, as John mentioned, incorporating your supply chain, your vendor relationships into that process obviously would be a big component of that. Well, if any of you still have additional questions or things like that, feel free to reach out to us. We'd be happy to get responses and feedback from either John, Colin, or Zebediah. But I want to say thank you for attending. Hope you learned something useful today. And on behalf of Convergence Networks and all the attendees, stay safe. Please focus on your cybersecurity. Thank you. Have a great day.
Bye bye.